Hi, everyone. My name is Professor Oliver, and this is a short presentation on explanation of benefits, also known as EOB. So, what is an explanation of benefits? An explanation of benefits is a form or document provided to a patient by their insurance company after they've received healthcare services for which a claim was submitted to their insurance plan. The EOB will give them information about how an insurance claim from a healthcare provider, such as a doctor or hospital, was paid on their behalf, if applicable, and how much they're responsible for paying themselves. They should receive an EOB regardless of the portion of the bill that the insurer paid. It might be none of it if the services weren't covered by their plan, or if the full cost was applied to their deductible and deemed their responsibility. A patient should receive an EOB if they have insurance that they purchased on their own, a health plan from their employer, or Medicare. And depending on where they live, they might get an EOB if they're enrolled in Medicaid and received healthcare services. But if they are a member of a health maintenance organization, an HMO, that pays their doctor through capitation, which is a set amount of money each month to care for the patient, they may not receive an EOB because their doctor is not billing the insurance company. This type of arrangement is not common, but it is possible. Okay, so information included in an EOB. Um, there's quite a few things. So just keep in mind that an EOB has a lot of useful information that can help a patient track their healthcare expenditures and serve as a reminder of the medical services that they've received during the past several years. So a typical EOB has the following information, as you can see on the slide, although the way it's displayed may vary from one insurance plan to another. So it will definitely have the name of the person who received the services, so the patient's name, which could be the person that carries the insurance or it could be one of their dependents. Um, it would also have the insured ID number, which is the identification number assigned to the patient by their insurance company. It should also match the number on the patient's insurance card. It will include a claim number, the number that identifies or refers to the claim that either the patient or their health provider submitted to their insurance company, along with their insurance ID number. Okay. It'll include the provider, which is the name of the doctor who performed the services. This may be the name of a doctor, a laboratory, a hospital, or other healthcare providers. Okay. Type of service would be included, which is a code and a brief description of the health related services received from the provider. Date of service, which would be the beginning and end date of the health related service they received. Charges, which would also be known as bill charges, right? Which is the amount the provider billed the insurance company for the service. Not covered amount would also be included. This is the amount of money that the insurance company did not pay the provider. Amount the health plan paid would be also included, and this is the amount that the health plan actually paid for the services that were rendered. Okay, so even if the patient met their out of pocket requirement for the year and they don't have to pay a portion of the bill, the amount the health plan pays is likely a smaller amount than the medical provider billed, thanks to network negotiation agreements between insurers and medical providers. Okay. And lastly, it would include a total patient cost, which is the amount of money that the patient actually owes as their share of the bill. Hope this was helpful. Thanks so much.